The information in this module will provide you with a better understanding of how total hip replacement surgery is performed. This module contains general health information and should not be considered as a replacement for the advice your doctor has provided you. The long-term goal of total hip replacement is to provide pain relief, restore normal activities of daily living, and enhance your overall quality of life. The first successful total hip replacement surgery was performed in England in the 1960s. Since then, it has been imported around the world and is now considered to be one of the most successful orthopedic surgeries available. Before we discuss the steps involved with total hip replacement surgery, it is important to remember that the decision to have any surgery is a serious undertaking and that all surgeries have risks. It is also important to remember that total hip replacement surgery is only one treatment option that you should discuss with your doctor. Other, less invasive treatment options may include things such as changes to your diet or exercise routines, over-the-counter or prescription pain medication, or the use of walking aids or other supportive devices. Once all non-surgical options have been exhausted, you and your surgeon may want to begin the discussion about total hip replacement. In total hip replacement, the prosthesis or implant is made up of 4 separate components. The femoral stem is made of metal and is implanted down the shaft of the thigh bone or femur. The ball or femoral head is attached to the upper part of the femoral stem and is designed to replace your original femoral head. The third and fourth components combine to create the acetabular section of the implant. These components consist of a metal shell and a plastic liner and replace your natural hip socket. Before you are taken to the operating room, your anesthesiologist will talk to you about the medications that will be used during the procedure, and he will administer the medications once you are in the operating room. Next, the surgeon will make an incision in your leg to access the hip joint. The surgeon will select the appropriate incision length and approach that is best for your case. You and your surgeon will determine the appropriate implant design, material, and fixation for your condition. After the incision is made and exposure is adequate, the ligaments and muscles are separated to allow access to the bones of the hip joint. The femoral head is then dislocated from the hip joint and removed at the level of the femoral neck. After the femoral head is removed, the cartilage of the acetabulum is removed using a special reamer that forms a hemispherical shape. The remaining void will allow for a proper fit of the metal shell. After sizing and checking implant fit, the surgeon will implant a shell. The next step involves preparing the femoral canal to accept the femoral stem implant. Special instruments are used to hollow out the femur to match the shape of the metal stem of the femoral component. Trial components are temporarily implanted to ensure proper size and fit of final implants. At this stage, the surgeon will move your hip in all directions to make sure trial components are implanted appropriately to achieve adequate range of motion. Once he is satisfied with the placement of the implant trials, he will insert the final components. Finally, the incision is closed. An external dressing is applied to the incision, and you will be taken to the recovery room. In the recovery room, the staff will monitor your vital signs until you are transferred to your hospital room. Total joint replacements are very complex procedures. However, the outcomes following surgery are most often successful. One of the critical success factors for positive outcomes is following the physical rehabilitation process. In order to achieve the goals for total joint replacement, you must actively participate in the rehab process and work diligently on your own. As you consider total joint surgery, remember that more than 250,000 people undergo it in the United States each year. It has become one of the most successful surgeries performed, helping patients reduce pain and enjoy a more active lifestyle. If you have additional questions about this procedure, talk with your orthopedist. If you would like further information about the joint replacement implant technology your surgeon uses, visit www.rediscoveryourgo.com.